Welcome to Luca and Miguel. Enjoy the video.
You should not attempt to remove a synthetic cast yourself. That risks skin injury and bone displacement. Instead, call your orthopedic clinic now and explain symptoms and timeline. While you wait, keep the limb immobilized and elevated to limit swelling and avoid weight bearing if instructed. Make sure you have your imaging dates, medication list, and any worsening signs noted. Once you've contacted the clinic, follow their immediate guidance. This keeps you safe and preserves proper healing. If removal must wait, focus on assessment and conservative care that won't alter the cast. Regularly check circulation and sensation. Look for pale or bluish skin, coldness, numbness, or tingling, and test capillary refill. Do not insert tools or try to create holes. That causes damage and infection. If swelling or pain increases, you may gently loosen clothing and apply a cold pack externally to the cast edge only if your provider approved it. Document changes, and the final step is professional removal. Trained staff use oscillating saws and assess the underlying skin and healing. Once done, they will inspect for wounds, take X-rays if needed, and provide immobilization or a brace as required. Begin any recommended rehabilitation exercises or weight-bearing progressions exactly as instructed. If the cast smelled foul, you have fever, intolerable pain, new numbness, or visible wound, seek emergency care immediately. Early intervention prevents complications.
Thanks for watching and please subscribe. It's the best investment you'll ever make.